Eric Sergienko, your county health officer here, giving you an update on the COVID-19 outbreak that is occurring in the world, in the United States, and here in California, but not yet in Mariposa. A lot has happened in the 12 days that have ensued since my last YouTube video, so we'll go through some of that. We have seen an increase of cases in the world to over 110,000. We have over 500 cases in the United States, and as of yesterday, 133 confirmed cases in the state of California. I think it's important to say that we have not yet had a case of community transmission in the San Joaquin Valley or adjacent counties, including here in Mariposa. You may have heard of the 2 cases in the San Joaquin, one in Madera and one in Fresno, but those were travel associated cases associated with the Grand Princess, and those folks were told to quarantine in their houses and to maintain a watch for symptoms. And when they did develop symptoms, they were very rapidly identified and tested, and so we were able to isolate them. That's what we do with sick people, is isolate them from everybody else, and then we quarantined their contacts. That is, people that they had contact with were told to stay at home and not go out and have contact with other people. And then those health departments in Madera and Fresno are tracking those contacts and keeping an eye on those isolated people to make sure that they don't spread disease to other people. So right now, for the San Joaquin, we don't have any community transmission, and we're still in what's called containment phase. That means if we were to have a case here in Mariposa, what our public health team would do is identify that case, isolate them, and then quarantine all the contacts for a 14-day period to make sure that we didn't have any further transmission of disease. That's in contrast to some of our counties in California to the north and the west of us. In Sacramento and some of the Bay Area counties, they have gone from a containment phase into a mitigation phase. In mitigation, they can no longer trace all of those contacts and all of those cases. So instead of trying to isolate and quarantine those individuals, they are applying community level measures such as discouraging large scale events, increasing social distancing, closing some schools. You may have heard that the Elk Grove School District closed down for a 1-week period, essentially moving their spring break up early. That was intended to, again, break a chain of transmission that may have established within the school district. So they're looking at doing things differently than we are in Mariposa currently. Again, we're still in the containment phase. Were we to need to move to mitigation, that is something we would get back here on YouTube, get onto our other social media, Facebook, and get out other messaging to say we're implementing those mitigation strategies. I have been in contact with the other health officers in the San Joaquin Valley, and I would say at this point, our intent is not to close schools, and we've communicated that with the superintendents and working with the superintendents in all of our counties to ensure that that's a shared message. We would, for businesses, encourage things that increase social distancing, like telework, working from home, altering your work schedules, things like that. Again, we put a lot out on our Facebook and our website that you can look at and pull that down and implement those for your particular activity. Other things that we've been doing here is about a week and a half ago, we activated our county EOC, our Emergency Operations Center. That was done just to do all these preparatory activities that we're talking about for you as individuals and you as businesses, for us to do at the county level. Things like, how are we going to do sick leave policy? How are we going to allow people to stay at home for a prolonged period of time and to do that telework? What are the policies and procedures we have to have in place? What's the equipment we need to have people go do telework? What are those essential functions that county government needs to do for you in person or can do remotely? So we're sorting all of those steps out through the coordinated activities of our Emergency Operations Center. So I feel we're very well prepared there. On the healthcare side of things, I've been working with John C. Fremont and their emergency preparedness team on not only identifying that first case in Mariposa, but what to do should we have a number of cases and have to hospitalize more than the normal number of people at John C. Fremont. We have gone through the drill, if you will, a couple of times with people that we felt might be persons under investigation. I will say all of those tests to date have been negative, and that's encouraging, showing that we are doing a good job of containing the disease south of Sacramento. But the other thing I'll say is those people have predominantly tested for flu A. So it's still the flu season out there. So those things that we want you to do for COVID-19, we would want you to do for influenza: washing your hands, covering your cough, staying home if you're sick, staying away from sick people, not touching your eyes, your nose, your mouth. Now there's some other things that I want to layer on this video, and that is things that we can do to protect our at-risk population. Our at-risk population are those from 60 and older, and those people who have underlying medical conditions like diabetes, heart disease, or lung disease. Now, I've been to Pioneer recently, and I know there hasn't been a run on toilet paper, and I don't feel like you need to do that. We've got that in good supply. But what I would ask our at-risk population to do is be ready to shelter in place for 14 days or so, just in case we go into the mitigation phase, and we ask you to shelter in place to stay out of harm's way. To be able to stay in place for 14 days, I'd ask, do you have a food supply that will allow you to do that? Do you have your medications? Do you have like a 30 to 60 day supply of medications? If not, that's something I would encourage you to work with your provider and your pharmacy to get. Do you have friends, family, other folks that can keep you up to date, keep you supplied, address any needs while you're in that position? Again, the biggest concern I have is not for someone my age or someone who's younger, but rather our older population, which makes up 26% of the county, and those people with underlying medical conditions. If we as a county can protect those folks, we'll come through this very well. So I look forward to our continued engagement. We do have our information up on our website, both Public Health, HHSA website, as well as the Sheriff. And we do have a email that if you've got questions, you can send them to. It's Mariposa COVID-19@gmail.com. That's Mariposa, MARIPOSA, COVID, COVID, 19, 1 and 9, @gmail.com if you've got questions. The other thing that we're thinking about doing is a Facebook Live, and we'll let you know if we do that, but that'll give an opportunity to actually get live with me on Facebook, asking your questions and expressing your concerns about this and how we can address that better. So thank you so much, and I look forward to talking further with you.